Okay, as promised, I have a week-to-week study schedule for the Ngn Nclex or the HESI exam. So behind me, what we're going to talk about today is the week-to-week study guide for Ngn Nclex. And like I said, this can be used to study for HESI as well. What you really want to know is the nurse who passes her test is organized, has a system, has a methodical way about approaching this exam. So that's what we're here to do, help you get your shit together. And the best thing I would say, if you're like me, like to write things and make little, signs or colors or whatever, get you one of those really big calendars. Mine always have the puppies on them. You can get them anywhere, Walmart, CVS, they're everywhere. Get the big calendar and plot out this schedule. Now, on the board behind me during this whole video, we have number one, the week-to-week schedule, but also we have what should you do today. So what I'm saying to you is you got to get busy. There is no time to sit on your ass and just chill out because you graduated and you're feeling some kind of special because you graduated from nursing school. Nah, that's bullshit. And don't think of going on vacation until after you've gotten this license. That would be the biggest mistake of people who failed their tests. All the nurses that failed their tests that went on vacation first feel strongly that it was that break in studying and that break in academia, like you're in study mode while you're in school. That break did them in, because they never got their mojo back when they got off vacation because they started working this new job, okay? Now, so let's say what you do today. Today, you buy Uworld RN and do the NCLEX RN assessment test today. Now let's talk about that. Not Archer. I said Uworld RN. Hey, LPNs out there. I didn't say Uworld LPN, did I? No. You might be thinking she made a mistake. No, I didn't. No, I did not. Listen, LPNs taking an LPN test. You need Uworld RN. The Uworld LPN is not difficult enough, to be honest with you. It doesn't have the EKGs that you're going to get on your exam. So I need you to listen to your girl. I'm the one with the PhD. You're the one that turned me on and are looking at me right now. So you must have given me some kind of credibility. Please do what I tell you. You will not be sorry. So again, do the assessment test. Let me tell you about this assessment test. This assessment test is 100 questions. If you know me from before in another video, you know that usually I tell you, make sure you do 30 questions an hour to pace yourself. I already know that you did more than that in nursing school. This test is not like nursing school. This test is based on quality, not quantity. They finally figured out what I've been teaching for years, 20 plus to be exact, and that was that you should allow the student adequate time to read, understand, and answer the test. So instead of giving you 5 hours for 200 questions or 6 hours for over 250 questions, the way they used to years ago, now you have 5 hours, no matter if you're LPN or RN, for 150 questions max. If you do the math, that's 30 questions an hour. Start pacing yourself. When you do this Uworld assessment test, when you sign up for Uworld, you'll get 2, usually sometimes even 3 assessment tests. You do the first one to figure out, where am I? Because depending on your score, you might need longer than these 12 weeks to get yourself together. So you want to do that. You can even text me and say, my pre-assessment, and you have to say, my pre-assessment was this. How long do you think I'll need? I can help you with that. It's no big deal to me. Now, how do you text me? You text me with 216-410-0936. And again, you just say, I saw you on YouTube. My pre-assessment score was this. How long do I need? Okay, and I can help you with that. Now, today, remember we're doing the today thing? The Today Show right here with Shelly, Dr. Shelly. Here we go. Today, I need you to check your ATT expiration date. What is an ATT, Dr. Shelly? It's an authorization to test. It gives you permission to test. It comes from the state you live in and the Board of Nursing that regulates nursing in your state. It's very important that you check the expiration date. All states are not created equal. Some states give you 3 months, others give you 6, a whole nother, like my state of Ohio and I think Pennsylvania, they give you a whole year. I think California might also do that. But so you got to know in your state, what is it? Is it 3 months, 6 months, a year? And then when you get your ATT, which you should not apply for if you failed before, until I tell you, or you get a certain score. But if you're a brand new graduate, when you get this ATT, don't be in a hurry to schedule your test yet. Chillax, okay? Just sit your ass down somewhere because you need objective scores to tell you when to take this test. And that's what I'm here for. I'm gonna help you. You got this. I don't want you to fail. All right. Today, the Today Show from Dr. Shelly. Today, you're going to visit this channel, HETV, Health Education Television, my channel, on YouTube today, and you're going to watch, you're going to go right to the playlist, and you're going to watch the Ngn Nclex self-study tips and guidance. You're going to watch those first 8 videos as orientation to how to pass, basically using free materials, right? Because I put my entire nursing program on YouTube. I mean, all 500 plus videos. So I need you to go ahead and just watch how to do it, okay? It even tells you how to set up your Uworld. It tells you how to take good notes. It tells you what to do with different videos on YouTube. Come on now, get it together. Today, like yesterday really, but today, you are going to begin the mastery program that I teach, one subject at a time. Here at Shelly's Nursing Review, we teach you to tackle one subject at a time. Quit just doing practice tests with everything in it. That is not beneficial. You need one subject at a time. Today, the last thing, today is your supplies. You want to buy, so that you can take really good notes, 3 5-subject notebooks, colored pens, and highlighters. Today! Okay, so I need you to let's go. Now, how do we do it from that point on, today, on forward to your license? I break the weeks up basically by subjects. 2 subjects a week are considered, 2 subjects a week is considered a good pace for most students who are new graduates. Now you got to be careful. I didn't say for students who failed before. I didn't say for students who went to a bad school. I didn't say for English second language students or international students. I didn't say for students who graduated years ago. I didn't say that. I said brand new graduates who just graduated within 30 days of graduating, which is the ideal time to start a review. This is a schedule you can use. Now, you will have to alter it slightly if your schedule is that you work full time. If you've got a couple of kids and you're the taxi mom or dad. If you got to take care of elderly parents and feed them dinner. Then, of course, this schedule needs to be altered for your specific situation. But for now, let's talk about what order to do this in. And by the way, if you were to order one of the Oh My God packets, don't worry, it has it in there, okay? But you don't even need to do that. You don't need to order anything. All of this can be done for free through my HETV videos, okay? So come on. Week 1, you need to do psych and psych meds together. And you will see if you buy your Uworld like I instructed that there are 2 separate categories, psych and psych meds. And you just click on both, boom, keep them together, do your questions. You might see it says mental health or something. Your next topic will not be Uworld questions, but it will be a series of videos to help you. And that is geriatrics. On NCLEX, geriatrics conditions and issues like Alzheimer's or dementia or delirium will be included in psych. So that's why I included geriatrics with this. Week 2 is renal and reproductive. Renal is huge and kind of easy. And then reproductive is not necessarily a bunch of videos that I have, but it is necessarily a subject matter on Uworld. And those subjects come up because the NCLEX exam has been trying to change their ways and ask more reproductive questions because clearly women's health is a big problem in our country, so much so that you've got the government trying to tell women what to do with their bodies and making abortion laws when they didn't think about miscarriages and ectopic pregnancies and sepsis and women's water breaking during pregnancy and women having no knowledge that they're pregnant before about 5 or 6 weeks. Dumbasses. So therefore, you will see more reproductive questions on the test. Now, the second subject, because these 2 go together when you do them on Uworld, they go together. The second subject is the acid, base, and electrolytes. Here's where there's way more videos that I need you to watch, but there's not as many questions on Uworld. That's important that you know that so you don't freak out. Respiratory, week 3, and then cancer, hematology, immunology. Respiratory is by itself. Look for the acute and the chronic respiratory videos. Look for the respiratory questions on your Uworld. But then when it comes to cancer, hematology, and immunology, keep all of these questions together. So you click on hematology, oncology, you click on immunology, keep them together on Uworld. They are so interrelated, you won't be sorry. It just makes sense, okay? So that's cancer, hematology, immunology. For week 4, this could take a little longer, but for week 4, you have your GI. GI, look what I wrote, takes the longest. And then in that same week, you're tackling musculoskeletal, which another name for that is ortho, and integumentary. Integumentary is skin, so think wounds and burns and things of that nature. That's what integumentary is. Week 5 is diabetes and endocrine. Now, Uworld will just call it endocrine, but my videos will separate them out. So go forward, would you? Week 6 is neuro and management of care. Now, for management of care, on the Uworld software, you will need to switch from subjects to clients' needs to tackle this. You will be so thankful for my management of care videos. It covers everything. Advanced directives, ethical, legal, prioritization, delegation, everything. Right in the management of care playlist on HETV through YouTube. All right, so that was your first 6 weeks. Now, if you're finding that your 6 weeks has turned into 4 and you're still on psych, guess what? Pump your brakes, change your test date. You don't need to take a test no time soon because you don't know this material, probably through no fault of your own. We got some really shitty nursing schools in this country. And I will say this, Florida has its share the most. Week 7. procedures, which is called reduction of risk, and basic care and comfort. Now, reduction of risk, the procedures, the reduction of risk, all that is an actual category on Uworld, and so is basic care and comfort. Okay, so if you've been paying attention so far, you've heard me talk about the Oh My God packet, which kind of gives you help with all of this. Has a lot of basic care and comfort in it as well, not to mention prioritization and delegation. And then you heard me talk about management of care down here, which was 20% of your test. And then you probably heard me say just now, procedures and reduction of risk, which is here in week 7, kind of important, okay? So what you're seeing is that I literally have resources to help you. They're not mandatory, but they do help you, okay? All right. Then you see cardio, EKGs, and cardio meds. Oh, let's talk about that for a minute. So if you think of cardio and cardio meds and EKGs, we do have some resources for you. We've got the EKGs, we've got your medication categories, which is where your cardiac meds are. And I'll say this because I think it'll help you. When you take this test, you will find that most of the medications on this NCLEX exam are psych meds or cardio meds. So that's why we focus this way. Now, week 9 is maternity. Why did you just put one subject, Dr. Shelley, on week 9? What was that shit about? Did you forget to add another subject because you're getting old and shit? Maybe a little Alzheimer's? No, hell no. It's because maternity is hard as hell. It's because maternity is so big. It's because maternity is so broad. It's because maternity has so many videos. It's because most students don't understand it. Okay, so what I'm saying to you is you need a whole week at least to do maternity. And let me just say this. Students are quite shocked when they take their exam and they find out how much maternity is on it. They're floored and they hate it. Ooh. Week 10 is peds and growth and development. You can see both of those on the Uworld. You will see tons of it on my channel, HETV. Week 11 is infectious diseases, and here you're going to start making flashcards. We have the list for you right here with our infectious diseases, and we have the list that you need to use to make your flashcards. Notice I did not say I have flashcards. I said I have the list of infectious diseases that you need to make flashcards of. Okay, making them is the deal. You learn more when you make them. And then you have your peri-op. Week 12, you have your pharmacology. And of course, I already told you about the medication categories. Here you have your hypertensive medications. You have your antihypertensives, okay? You have your diuretics. You have your, your diuretics. You have your ICU medications. You have your anticoagulants and thrombolytics. You have everything you need for all categories of medications. And then we have a nice little checklist packet. So every time you do your Uworld and you get a medication, you can use this alphabetically ordered packet to go find that medication and literally check it off because Uworld covered it. Now, when you're done with all these weeks of tests, when you're done with all these quizzes and you're doing your Uworld and you're doing everything you're supposed to do with the videos, you have something left to do. And let me just say, just in case you don't get to watch the 8 videos on HETV, When I say begin your mastery, that means that you are doing a ton of little baby quizzes all day long. Baby quizzes have no more than 25 questions on them, preferably even less than that. So if you woke up today and you have a day off, you're only doing 5 to 25 questions in one test, but you're doing a lot of tests that day. So let me explain, because some people think you only need one test a day. No, what I'm saying is you woke up, because it's your day off, you woke up, you grabbed your phone, you did 5 Uworld questions. Later, after breakfast, you did 10 Uworld questions in your mastery topic. Then you had some time after lunch, you pulled up the videos, you watched your psych videos, and you did 25 psych questions from your Uworld. Later for dinner, you just did 5 because you were rushing, you had to go get the kids. Right before bed, you did 5 more. Now that was a whole lot of tests in one day. That's your life from here until you take your NCLEX or HESI exam. All day, every day, doing tests all the time. Miniature little quizzes, teeny tiny little quizzes, because you got to review the rationales. And then after that, once you get the score you need, and let me just tell you about that score that you need. Nurses, you need an 80 to 85% before you go scheduling your test. And you need it on all of these subjects. So I know that you did Archer or you did Uworld and it said you had a great chance of passing because you got a 70 some odd percent. Bullshit. Think common sense. If you're a teacher and you gave all your students a test, they got 100%, that would be an A+. If they got a 90%, that's a B+. If they got an 80%, that's a C+, and anything below that is failing in nursing school. So stop thinking your little averages of 50s to 60s. I talked to somebody today, their average on Archer was 58%, and they thought they could take a test. Why? 58% is a fucking F. Come on, guys. Let's think common sense. That's why I'm saying don't apply for your test right away. Get the scores you need. Now, how will you know when to schedule your test exactly? Like, what week should you take this test? Look at this. As you're going through these weeks and you're noticing your scores are going up, you should tentatively schedule your test for like a month from that point. And here's the thing, guys, you can always change your test date. You don't have to pay to do that. You don't get in trouble for doing that. You could change your NCLEX test date 7,000 times and be fine. Unlimited, in other words. But here's the way you seal the deal. You watch HETV and you watch the video in the playlist that says 1 week before your test. And you obviously do that a week before your test. That week, you do another Uworld RN assessment to see if you're ready. If you didn't get a 75 to 80% on that test, because those are all new questions you've never seen before, don't take your test. You're gonna fail. I don't want you to fail. And no, I'm not God, but God told me to tell you that I know a lot and that you probably should listen to me, okay? God can always work it out. He's amazing. But I think that this is my ministry and I'm here to help you because, again, I did it all for free. This video is for free. 500 videos just like it is for free. And I don't need the money, so I wouldn't lead you astray. I don't have an ulterior motive to tell you don't take your test. Think about it. I'm in Ohio. I don't care. Deuces. I hope this helps. And God bless all of you.